4, 3, 2, 1, starts.
A very good evening to all of you. So here we are from Caveman presenting to you healthy eating habits and a nice lifestyle. So I hope the senior citizens special and young Indians and CII Sarva, we are conducting this thing. So let's go on to the presentation. I hope you enjoy it. So, keep your taste buds happy, a fun-based diet plan, right? And then what do we want to do? We want to stand out. We want to be the best. We want to be beautiful. We want to be or particular right? And we want to stay young forever. They look always young, forever young. So how do we do this? Healthy inside. You have to be, for that, you need to be healthy inside. Then only you can glow outside. If you go to Google, Yahoo, Wikipedia and search stomach pain, headache, I don't always Google when I'm sick, but when I Google, I have cancer. That everything you search will give some really scary thing, really scary answer. So don't Google and go for all these things. Let's look at the recipe for health. Get it from the doctors. So eat well, live well, and be well. And you are actually what you eat. See, look at this burger. In Dhamma burgers after burger mari aitanga. So diets which is the healthiest diet? Diet abhina diet pandrathu, diet weight loss pandrathu kadayadu. Diet means what you eat, which is the best thing to eat. Healthy Mediterranean diet, Paleo diet, keto diet. Idella fashion when you talk about all this specific carbohydrate diet, Ornish diet, vegan diet. Let's see which one to use. Finally, we are confused. But Mediterranean diet is very simple. Just like half of the plate is covered with vegetables and fruits, right? Especially vegetables. And then you have rice kai opposite. Rice rice portion, right? Protein fish and water vegetable fruits so and nuts and olive oil use this is Mediterranean diet. This is take home vegetables and fruits portion increase rice that's a lovely way to start a diet. So I'm on a seafood diet. The Mediterranean diet is a seafood diet. So I see food and I eat it. I will be gaining weight like this boy. So there are low carb diets. If carbohydrate is poison, body they say less carbohydrate. I don't at all. I won't fight with them saying it's perfectly okay. And low carbs will help in weight loss and metabolic syndrome. Metabolic syndrome abdina BP, sugar, heart problem, fatty liver. Idellame saying the metabolic syndrome in solvom. Idellame obesity. In the truncal obesity, waist size perisa irukravungalukku obese irukravungalukku varakudiya oru noi or ella combination or family da varum. So adukku in the low carb diets helpful ah irukku solranga, but carbohydrates kammi pannadhu avlo easy kedaiyadhu. Adukku neenga substitute vera edavadhu panni aganum. Adha neenga I'll show you what we do. So ipo pathina idhila ketosis develop keto diets especially the FITTs seizures they use keto diet. They again with the doctor's help only you can do all that. Now paleo diet paleo diet we have evolved from cavemen. Cavemen, what do they do? They eat only berries. Avanga kaikku enna kedaikudho அதுதான் சாப்பிடுறாங்க இல்லையா? அதனால நம்ம அதைத்தான் சாப்பிடணும், அதுதான் நமக்கு நல்லது அப்படின்னு சொல்றாங்க. அதுல பேலியோல பிரெட் இல்ல, பீன்ஸ் இல்ல, see no grains, no beans and legumes, no milk, no corn, no rice. So இத்தனையும் இல்ல. அப்ப என்னதான் இருக்குன்னா மீட் இருக்கு, fruits and vegetables, nuts and berries, நிறைய தண்ணி குடிக்கணும், exposure to sunlight. பட் இதுல என்ன ஒரே ஒரு பிரச்சனை அப்படின்னா பெனிஃபிட்ஸ் பார்க்கலாம். ஸோ இட் கேன் ரிவர்ஸ் த ஏஜிங் ப்ராசஸ், பெட்டர் டைஜஷன், burn fat, boost energy, better immunity எல்லாம் ஓகே தான். நாட் ஈஸி டு மெயின்டைன், பட் கார்டியோவாஸ்குலர் ரிஸ்க் வந்து ஜாஸ்தி. ஏன்னா ரெட் மீட் சாப்பிட்றவங்களுக்கு ரொம்ப ரிஸ்கி, வெஜிடேரியன்ஸ்க்கு ரொம்ப கஷ்டம். ஏன்னா நிறைய லிமிட்டடா தான் இருக்கும் அவங்களுக்கு சாய்ஸ். பட் ரெட் மீட்ஸ் வந்து இட்ஸ் ரியலி கோயிங் டு பி ஹார்ம்ஃபுல். கடைசியில வந்து யூ வில் பி லூசிங் வெயிட், பட் யூ வில் பி கெட்டிங் ஹார்ட் டிசீஸ். ஸோ யூ ஷுட் பி கேர்ஃபுல். இப்போ வெஜிடேரியன் டயட் ஃபுல்லா வெஜிடேரியன், அந்த B12 டெஃபிஷியன்சி வரும். அதனால எந்த டயட் எடுத்தாலும் அதை பத்தி ஸ்டடி பண்ணுங்க. டிசீஸை பத்தி ஸ்டடி பண்ணி பயப்படாதீங்க. ஃபர்ஸ்ட் எந்த டயட் எடுக்கிறோமோ அதுல என்ன இருக்கு, என்ன நியூட்ரியன்ஸ் குறையும், நம்ம என்ன சப்ளிமெண்ட் பண்ணணும், எதை செக் பண்ணிக்கணும், எல்லாம் பார்த்துக்கோங்க. எதுக்காக இது பண்றோம் அப்படிங்கிறது முக்கியம். வெயிட் லாஸ்க்காக பண்றீங்களா, ஹெல்த்காக பண்றீங்களா, ஆல் தட் இஸ் இம்பார்ட்டன்ட். There's another thing called intermittent fasting. It actually weight loss kaga vandu I started advising for my patients, and ipo vandu it's a lovely thing to understand what happens. Ipo vandu usually nama ஸ்லீப்பிங் டைம்ல என்ன ஆகுது அப்படின்னா, the body metabolizes நம்ம பாடிக்குள்ள இருக்கிற ஃபேட்டை அதே எரிச்சிடுது. நம்ம பாடிக்குள்ள இருக்கிற அனாவசியமான ஏதாவது ஆக்சிடென்ட், ஃப்ரீ ரேடிக்கல்ஸ் அதெல்லாம் தானா எரிச்சிடுது. And all the dead cells are destroyed. So many things happen when we are sleeping, and that's because we go into something called the fasting phase. So when the body goes into the fasting phase, உள்ள இருக்கிற இதெல்லாம் வந்து மெட்டபலைஸ் பண்ணக்கூடிய ஒரு தன்மை வருது. அது வந்து நம்ம மெயின்டைன் பண்ணா போதும். இப்போ வந்து நம்ம எப்படியும் ஒரு 6 to 7 hours 8 hours தூங்குறோம் அப்படின்னா அதை வந்து கொஞ்சம் இப்படி அப்படி எக்ஸ்டெண்ட் பண்ணலாம். அதாவது தூங்குறதுக்கு முன்னாடி டின்னர் வந்து கொஞ்சம் முன்னாடியே சாப்பிட்டுட்டோம், தூங்கி எழுந்திரிச்சதுக்கு அப்புறம் பிரேக்ஃபாஸ்ட் கொஞ்சம் லேட்டா சாப்பிட்டோம் அப்படின்னா அதுலயே உங்களுக்கு வந்து 14 hours ஆஃப் கேப் கிடைக்கும். வெயிட் லாஸுக்கு வந்து அட்லீஸ்ட் 16 hours 14 hours இருந்தாதான் வெயிட் லாஸ் ஆகும். ஈவன் நார்மல் பீப்புளுக்கு வந்து ஒரு கொஞ்சம் அந்த fasting period vechita nalladhu. See, we know in several religions they fast so many a whole month. நமக்கு தெரியும் அது எவ்வளவு பெனிஃபிஷியலா இருக்கு, எத்தனை ஒரு டாக்ஸின்ஸ் பாடியில கொல்லுதுன்னு. why not do it every day? I'm not telling sugar patient இது பண்ணணும்னு நான் சொல்லவே இல்லை. சுகர் பேஷண்ட்டுக்கு வந்து இட்ஸ் நாட் பாசிபிள். நீங்க டயபெட்டிஸ் மெடிசின் எடுத்துட்டு அப்புறம் வந்து வெறும் வயிற்றுல இருந்தீங்கன்னா சுகர் தான் டவுன் ஆகும். that's not going to be helpful. But those who are okay, those who are not too old, மயக்கம் வராது, அதனால தாங்கிக்க முடியும், வெயிட் லாஸ் ஆகணும் அப்படின்னா மெதுவா எக்ஸ்டெண்ட் பண்ணுங்க. டெய்லி 9 o'clock சாப்பிட்டவங்க மெதுவா டின்னர் சாப்பிட்டவங்க மெதுவா 8 o'clock வாங்க, அப்புறம் 7 o'clock வாங்க. ஸோ 7 o'clock or 6:30க்கு டின்னர் முடிச்சுட்டு மார்னிங் வந்து ஒரு 9:30 or 10 o'clock பிரேக்ஃபாஸ்ட் சாப்பிட்டீங்கன்னா நடுவில் வந்து you should not have anything. You can have green tea if you want, and really it helps to prevent cancer. It reduces inflammation and oxidative stress, and நிறைய பேருக்கு வந்து weight loss excellent ஆகி எக்ஸசைஸே இல்லாம, I know exercise and diet are both needed for weight loss, but எக்ஸசைஸே இல்லாம weight loss ஆன patients நான் பார்த்திருக்கேன். Actually I should thank my patients, they taught me a few things from that. Now let's look at vegan diet. So vegan diet வந்து plant-based diet. So வெறும் plants மட்டும் தான் சாப்பிடணும், பால் கூட குடிக்க மாட்டாங்க, egg சாப்பிட மாட்டாங்க, non-veg சாப்பிட மாட்டாங்க. So if a vegetarian diet வந்து it reduces the risk of heart disease, increases the lifespan, decreases the cholesterol, எல்லாம் okay, reduce obesity, எல்லாமே ஓகேங்க. But look at that, they can have protein deficiency and low bone mineral density if they are not cautious. இப்போ அவங்க protein எடுக்கலன்னா protein வேற ஏதாவது சப்ளிமெண்ட் பண்ணுவாங்க, டோஃபு எடுக்கணும், ஆல்மண்ட் மில்க் எடுக்கணும், எக்ஸ்பென்சிவா இருக்கும். பட் அதுக்கு பண்ணிதான் ஆகணும். அப்போதான் அவங்க வந்து they can hold on to their protein level in the body. And vitamin B12, vitamin mineral deficiencies எல்லாம் கண்டிப்பா வரும் அவங்களுக்கு. They have to supplement, test and supplement. And அப்புறம் நிறைய பேர் கேட்கிற கேள்வி, அதனாலதான் இந்த மாதிரி ஸ்லைட்ஸ் போட்டேன். Which rice is best? White rice எடுக்கலாமா, எடுக்கக்கூடாதா? எப்பவுமே வந்து what is more crude and more unrefined, unpolished is always better. So brown rice is better because of fiber. In the black கவினி அரிசி வந்து it has low glycemic index and high iron and protein. Red rice வந்து most nutritious rice and has anthocyanins which are antioxidants. So riceல சொல்லிட்டேன். காஃபி எடுக்கலாமா, காஃபி நல்லதா, காஃபி லிவருக்கு நல்லதுன்னு சொன்னாங்கன்னா yes, coffee is good for the liver, but be cautious. Gastritis எல்லாம் இருக்கிறவங்களுக்கு வந்து I cannot say take coffee, and green coffee is even better for the liver, and this is non-roasted and it is very rich in chlorogenic acid and we have this VGM's green coffee, which is like a drink. Now, which oil to use? Oil, I get this question all the time from patients. That's why I put it up. We know coconut oil, நம்ம ஊரோட ஆயில் நம்மளோட நாட்டோட ஆயில் பார்த்தா coconut oil, it seems to have a lot of benefit, but கொஞ்சம் அந்த saturated fat increase பண்ணுமான்னு தெரியாது. ஆனா inhibits inflammation and it helps in brain boosting, a lot of immunity related இதெல்லாம் better ஆகுதுன்னு சொல்றாங்க. We know that, but we are not sure about fat. Saturated fat வந்து bad for the heart. So அது வந்து நம்ம check பண்ணிக்கணும். Olive oil has been touted as the best oil. எங்க கிடைக்குது ஆலிவ் ஆயில்? நமக்கு அவ்வளோ ஈஸியா கிடைக்காது. அதுலயும் வந்து எக்ஸ்ட்ரா வர்ஜின் ஆலிவ் ஆயில் யூஸ் பண்ணணும். அப்பதான் வந்து it will actually be helpful. But it's a very good oil because it has omega-9 fatty acid, and that is really beneficial. And you can't fry in olive oil. That's very important because it has a low smoke point. And any oil use பண்ணாலும் first know what is the positive and what is the negative. Palm oil is very bad, we know that. And groundnut oil is good, many people use it, but again you should know that some fungi can grow if it's not stored properly. So many things are there like that. And rice bran oil, but secret is just use less oil. Oil is not very good in excess quantity. Polyunsaturated fat, monounsaturated fat, saturated fat நல்லா இருக்குது. Non-saturated fat யூஸே பண்ணக்கூடாது. அது டால்டா மாதிரி. Palm oil வந்து 42% of SFA and it's harmful to the heart. omega-3 versus omega-6 அப்படின்னு எடுத்தீங்கன்னா சன்ஃப்ளவர் ஆயில் வந்து நிறைய omega-6 இருக்கு, பட் நமக்கு omega-3 அதிகமா இருந்தா ரொம்ப நல்லது. ஃபர்ஸ்ட் எல்லாம் சன்ஃப்ளவர் ஆயில் தான் குட் ஃபார் த ஹார்ட்னு சொன்னாங்க. If it's not like that, it's fish oil, but of course you can't cook in fish oil, but fish oil is very good for the heart, brain, and it's anti-inflammatory. So omega-3 எதுலெல்லாம் இருக்கு other than fish oil? You can see it in olive oil, also in some proportion, walnuts, flax seeds, navy beans, pecans, and green leafy vegetables, kidney beans. Just remember, it's very important. But whatever is your diet, make sure you have protein. So we know non-veg source of protein, right? White meat is good source of protein, and milk, tofu, nuts, eggs, legumes, ellame is good source of protein. Yogurt, antioxidants இருக்கணும் ஃபுட்ல, எப்பவுமே antioxidants இருக்கணும் பார்த்துக்கோங்க. அதுல எல்லா பெரிஸும், என்ன பெரின்னு சொன்னாலே இந்த நவப்பழம், பெரிஸ் and turmeric, இஞ்சி பூண்டு, all these பட்டை, கிராம்பு, everything, they're all source of antioxidants. And don't forget our favorite amla, and feed the bacteria of the gut. ஏன் பாக்டீரியாவுக்கு ஃபீட் பண்ணணும்? இது நம்ம குடல்ல வந்து நிறைய பாக்டீரியா இருக்கு. millions of bacteria are there, and there are different types. அதுல வந்து அந்த ratio of good and bad, the ratio of the good and bad வந்து மெயின்டைன் பண்ணணும். good வந்து நல்லா ஹையா இருக்கணும், bad வந்து கம்மியா இருக்கணும். அதுக்கு வந்து that's a big thing. எல்லா டிசீஸுமே வந்து குடல்ல இருக்கிற பாக்டீரியானால தான். அது வந்து நம்ம இதோட பேலன்ஸ்ல இருக்கு, நம்ம உடம்போட பேலன்ஸா பண்ணிட்டு இருக்குங்க. ஸோ அது வந்து so many diseases root cause வந்து அதுதான் சொல்றாங்க. So probiotic bacteria gives a good health, அது வந்து good mental health. And so இப்போ நீங்க டென்ஷன் ஆறீங்க, அப்செட் ஆறீங்கன்னா, it could just be the bacteria in your gut. Okay, remember that. அப்படி ஆயிட்டு இருக்கு இப்போ கதை. So dysbios of human microbiota has become such a hot topic. Everything in the whole world is related to that. Obesity, அப்பனா நீங்க வெயிட் அதிகமா இருக்கீங்கன்னா அது உங்க தப்பு கிடையாது, உங்க குடல்ல இருக்கிற பாக்டீரியால கூட இருக்கலாம். So diabetes, metabolic syndrome, cancers, asthma, lung cancers, and autism, psychiatric disorders, atherosclerosis, heart diseases, skin diseases, neurological diseases, all memory power, everything is related to the microbiota. So அப்ப நம்ம மைக்ரோபயோட்டா நம்ம பார்த்துக்கணும்ல. அப்போ நல்ல மைக்ரோப்ஸ் வந்து குடலுக்கு போய் சேரணும். அதுக்கு வந்து மெயினா வந்து யோகர்ட், நிறைய தயிர் சாப்பிடணும். அண்ட் இதெல்லாமே ஃபர்மெண்டட் ஃபுட்ஸ் நம்ம பார்க்கறது இல்லை, யூஸ் பண்றது இல்லை, பட் மெயினா தயிர் சேர்த்திக்கணும். அண்ட் ப்ரீபயோட்டிக் ஃபுட் சேர்த்திக்கணும். ப்ரீபயோட்டிக்னா அந்த பாக்டீரியாவுக்கு ஃபுட். So food for the bacteria. So what are the food for the bacteria? Food. So many things are there. அதுல வந்து sprouted stuff, பூண்டு, cabbage, and banana, and inulin ஒன்னு இருக்கு, but எல்லாத்தை விட apple cider vinegar, everything okay, but these are my favorite. ப்ரீபயோட்டிக்னா பாக்டீரியாவுக்கு ஃபுட். ஸோ இதெல்லாமே வெந்தயம், சீரகம், சோம்பு. ஸோ தீஸ் ஆர் திங்ஸ் லைக் ரியலி பெனிஃபிஷியல். யூ கேன் ஜஸ்ட் சோம்பு வந்து தண்ணியில சோப் பண்ணிட்டு காலையில குடிச்சுக்கலாம். சீரகம், சோம்பு வந்து கஷாயமா எடுத்துக்கலாம். And this is really a favorite, and this helps so many of my patients. பழைய சாதம் சாப்பாடை வந்து ஊற வச்சுட்டு தயிரோட வெங்காயம் இஞ்சி போட்டு காலையில எடுத்துக்கிறாங்க இல்லையா, பழைய சாதம். ப்ரொடெக்ட்ஸ் அகேன்ஸ்ட் IBS, IBD. என்னோட பேஷண்ட்ஸ் குடல் ப்ராப்ளம் இருக்கிற பேஷண்ட்ஸ்க்கெல்லாம் I'm giving and lot of people say that their skin and hair is better with that. And don't take antibiotics. Don't take all these acidity medicines all the times and antibiotics, because these things will destroy the bacteria. உள்ள இருக்கிற பாக்டீரியாவை கெடுத்துரும். And please watch this immunity booster talk by Dr. Suman CPS on the same channel. It's there. You'll see a lot of immune boosters which he has talked about, where you can see all the foods rich in all these immune boosters. How to boost your immunity? It's not just the food. நம்ம காமா இருக்கணும், எக்ஸசைஸ் பண்ணணும், யோகா பண்ணணும், நல்லா தூங்கணும். இதெல்லாமே ரொம்ப முக்கியம். மென்டல் ஸ்ட்ரெஸ் இல்லாம இருக்கணும். These are all immune boosters. And vitamins and minerals. Dietary fiber ரொம்ப முக்கியம். ஸோ இப்போ நம்ம ஃபுட்டு சாப்பிட்றோம், என்னெல்லாம் சாப்பிட்றோம்னா அந்த ஃபைபர் கூட இருக்கணும். அதுல ஃபைபர் இருக்கான்னு டெய்லி செக் பண்ணணும். அப்போதான் நமக்கு கான்ஸ்டிபேஷன் ஆகாது. அந்த ஃபைபர் வச்சுதான் இந்த பாக்டீரியாவும் வளரும். It will get this small chain fatty acids from the fiber and it will grow. So all these things are very important. Millets also are rich in fiber. So நீங்க ரைஸுக்கு பதில் millets எடுக்கிறீங்க, ரைஸுக்கு பதில் ரெட் ரைஸ் எடுக்கிறீங்க, that will definitely help everything, the bacteria and the constipation part. And eat the rainbow. So this is a lovely thing here. Eat the rainbow, where இந்த மாதிரி colored foods எடுக்க வேண்டாம். இந்த மாதிரி எடுங்க. ரெட் கலர்ட் ஃபுட் ரிச் இன் ஆன்டிஆக்சிடென்ட் அண்ட் ஆன்டி கேன்சர். yellow colored நமக்கே தெரியும், கண்ணுக்கு ரொம்ப இம்பார்ட்டன்ட். பம்ப்கின், கேரட், பப்பாயா, அதெல்லாமே, ரைட்? And immunity and antioxidants in green color food. And purple color food, expensive, but yes, it is very beneficial, especially the berries. And white and brown color food, and the vengayam and pundu are like really good for all immunity. And don't say no to black color. So go for color, don't take black colored food which was burnt na, and the burnt idhula vandu free radicals irukku, and the free radicals cancer urvakum. So why are food eaten outside bad? Ipo na velila saapren, adhe yen adu mosam, na veetliyo adhe da saapren, velila poi dosa idli saapta mattum yen adu venam solreenga appadina, you see வெளியில வந்து they will not control how much carbohydrate they are adding, how much oil they are adding, how much salt they are adding. That's why the food is tasty, right? So much oil, fat and carbohydrate. அப்புறம் காய்கறி அவங்க கழுவுவாங்களா? நீங்க எத்தனை வாட்டி கழுவுவீங்க வீட்டுல? Do you think they will do the same in restaurant, or do you think they will use different oil every time? Like, okay, you can reuse oil for a limited number of times. How do you know how many times they are reusing? You don't know. And there are so many studies. இப்போ இது மாதிரி பண்ணிதான் வந்து cancers, repeatedly using cooking oils can cause cancers, especially breast cancer. Studies are there to show that. So water hygiene பார்க்கணும். வெளியில போனீங்கன்னா don't drink unboiled water or something. RO, UV or boiled water should be there when you drink. And don't eat unboiled food like chutney, juice or pachadis, because they will be adding the water. அது boil ஆகாது. அது அப்படியே நீங்க எடுத்தீங்கன்னா இருக்கிற பாக்டீரியா உள்ள போயிடும். That is going to cause a lot of your gut problems. As a gastroenterologist, I thought I have to say that. So we want low salt, low sugar, low processed food, low fat, low red meat, and don't have burnt food. So best thing, eat வீட்லயே சமைச்சு சாப்பிடுங்க as much as you can. Try to go organic as much as possible. Cultivate a kitchen garden. And also get your children to do that. That's a lovely way to get them used to it. And eat traditional food native to the place of your origin. நம்ம கலாச்சாரம், நம்ம ஃபுட் நமக்கு நல்லது அப்படிங்கிறது வந்து நம்ம ancestors சொல்லியிருக்காங்கன்னா அதுல வந்து துளி அளவாவது இம்பார்ட்டன்ஸ் இருக்கணும். ஸோ அந்தந்த ஏரியாவுக்கு தேவையான டயட்ஸ் பார்த்தீங்கன்னா it will be the best for those people, right? And avial, you can see all the low cost vegetables will be there in the avial, and that is a true avial, which is like native things which they use, and you know how healthy it is. And sukku milagu tippili, see how all these things are there. We don't know their importance, better to use our own traditional foods as much as possible. And idli, fermented food, it has protein, curd, probiotic, sambar has antioxidant, turmeric, mustard, curry leaves, protein as dal, and minerals and as vegetables, right? So இப்போ இது மட்டும் சாப்பிட்டா இன்னைக்கு இட்லி தான் சாப்பிட்டேன், டெய்லி இட்லி தான் சாப்பிடுறேன் அப்படின்னு சொல்றீங்க. ஆனா that is like it's so healthy, right? So that's what it's a wholesome meal. And eat to live, don't live to eat. And of course, not just eating, please do your work, live, laugh, and love. And please do your exercise and yoga and keep yourself healthy, and mentally also do meditation. Check for diseases. You say, I am doing very well, I will not get checked. அப்படி இல்லை, ஏதாவது பிரச்சனை இருந்தா go get checked. And alcohol and smoking, please say no to it. And here this man, அவர் கம்ப்யூட்டரையே பார்த்துட்டு எல்லாம் பண்ணிட்டு இருக்காரு, டெய்லி இதை பண்ணிட்டு இருக்கீங்க, எதை பத்தி எழுதிட்டு இருக்கீங்க அப்படின்னா அவர் ஹெல்த் பத்தி எழுதிட்டு இருக்காராமா. So eat a veggie or fruit every meal, reduce the carb portion, choose organic, eat homemade food, include fermented foods for good bacterial health, have a long fast period. நான் சொன்னேன் இல்லையா, intermittent fasting எல்லாரும் ஃபாலோ பண்ணணும்னு சொல்லலை, பட் ரொம்ப லேட் நைட் சாப்பிட வேண்டாம். ஏர்லி டின்னர் முடிச்சுட்டு கொஞ்சம் லேட் பிரேக்ஃபாஸ்ட், நடுவில் வந்து green tea. Don't keep eating something. Give a fasting period for your stomach during the night so that it regains good health and destroys bad cells. Less refined or polished food. Eat traditional foods native to your place. Rotate foods. ஒரு நாள் ஒரு வாரம் இதுன்னா அடுத்த வாரம் வேற டிஷ்ஷஸ் பண்ணுங்க. So that will be very useful for your gut bacteria. And eat the rainbow. Thank you very much. I'm signing off from VGM Hospital. Hope you enjoyed the talk. So now next we'll be having Dr. Suman CPS for his talk. Please be with us just for a few minutes.
Good evening, everyone. This is Dr. Suman. Just give me a minute. I'm just setting the slides. Okay, so good evening again. It was very nice yesterday. I hope you all enjoyed the program yesterday. நேத்து கொஞ்சம் exercises எல்லாம் demonstrate பண்ணி காட்டணும். I'm sorry, நான் சர்ஜரில இருந்து அர்ஜென்ட்டா ஓடி வந்தேன். So Dr. Madra first அதனால தான் பேச சொன்னேன். I was supposed to be the first speaker. Okay, so today's நான் நேத்தே promise பண்ணேன் how to 1 second please. pepper soup. Is it audible now?
Yes.
Is the mic off? Audible. All right. Thank you. Okay. Fine. Sorry. Yeah. Technical glitches when we go across speakers. All right. So yesterday itself, when I spoke and I demonstrated, I exercise and demonstrate panambod, I said there are some tips what you have to follow. I promise tomorrow I'll teach you because we can't cover everything on the same day. நீங்க மறந்து போயிருவீங்க. இதே வந்து 4-5 பேர் எனக்கு மெசேஜ் போட்டாங்க, டாக்டர் நிறைய இருந்துச்சு அப்படின்னு. பட் please understand, yesterday's presentation is fully recorded. It is available on YouTube forever and forever. VGM Ortho Center is my own channel. So this is my 80th or 90th or 92nd video, something like that. And today is the 93rd perhaps. So idella useful tips, nothing to worry. Okay, now number 1 in the presentation is a part of Caveman Young Indians, and our target is to help senior citizens live a better life. We thank you so much for doing everything to the society of Coimbatore, and something we middle-aged and seniors want to do something back to you all. All right. So in case for people below 45 years, you need not exercise every day. Don't stick to hardcore diets. Internet age below 45 years only. But if the age above 45 years, you have to exercise daily. Please mark my words, right? You have to exercise daily. You have to take hardcore diets. Not really hardcore, you can still have fun. Dr. Madhura said how to have a wonderful diet, what you should avoid and what you can have. So like she said, avoid outside food, very minimal you keep it, otherwise you will be fine. And what to eat, some basic items. அவங்க சொன்னது at least 40-50% follow பண்ணி balance 50% merge பண்ணா கூட you will have a healthy and happy life. Same way for me, if you follow my tips for exercise just for 30 minutes to 1 hour a day, you'll do wonderfully. All right. And number 2, age above 45 or below 45, you need not serve the net. It does not matter at all. Okay. Now this internet such a nuisance. We call it the idiot syndrome. Okay. Internet derived treatment, obstructing treatment அப்படின்னு சொல்லிட்டு சொல்லுவோம். Internet derived information obstructing treatment, idiot அப்படின்னு சொல்லுவோம். So don't sit and waste your time on all that. 100 websites will teach you 1,000 things which will be 10,000 times wrong. That's the way I look at the internet. Just learn from what we are trying to tell you. I always thank my gurus from South Korea, United Kingdom and Germany. In the 3 countries I had the opportunity to work, and yes, I worked in Mumbai and KMC Manipal, Kasturba Medical College as an assistant professor in orthopedic surgery. And today, after 18 years, what I am is thanks to my gurus. I am a consultant with Lalita Hospital, Crosscut Road, Coimbatore. These are some small disclaimers I always say. And VGM Hospital, Trichy Road, Coimbatore. Our hospital has helped me use the facilities of the EDP department. I hence thank VGM Hospital management for enabling me to do this presentation for Coimbatore Villa as a part of the celebrations for young Indians. And please visit your doctors. Many a time, Dr. Paatiki 70 vayas aachu, I cannot bring her to the OP. Here, see her reports. Abhin or 30 pages kondu varuvanga. Doctor, I'll pay your consultation fees, okay? But please, I cannot bring her. Believe me, there is nothing called the touch of a patient. I don't like online consultations, etc. I want to see the patient with my own eyes, examine them, see their old records, get new records. There is no shortcut for success. Okay. This is a middle-aged Telugu Brahmana lady. 2015-16 range, his son brought her video to me. Okay. Now, in the photo, it is bent, right? So, arthritis has happened. So she needs to undergo knee replacement. Straight away they'll tell. I'm sure you'll also tell that, right? Okay. See, this is the video he brought to me. வீட்ல ஒரு சேரை வந்து வாக்கர் மாதிரி யூஸ் பண்ணிட்டு இந்த அம்மா கஷ்டப்பட்டுட்டு இருக்காங்க. Okay. I said இதை விட மோசமா வளைஞ்சவங்க, more arthritis இருக்கிறவங்க கூட வந்து they walk better அப்படின்னு சொல்லி நான் சொன்னேன். Look at the difficulty on her face. Okay. So I took a long leg X-ray views and I found a fracture in the middle of the leg. In the இடத்துல தொடையில. So எலும்பு மட்டும் joint மட்டும் வளையல. இங்க எலும்பு உடைஞ்சிருக்கு. இந்த வியூல உங்களுக்கு நல்லா தெரியும் பாத்தீங்கன்னா. See, look at this leg. Left leg straight ஆ இருக்கு. Right leg பாருங்க வளைஞ்சிருக்கு. தெரியுதுங்களா? இங்க fracture. விழாம fracture. So clinical diagnosis and expertise, and not only that, even your exercises, everything should be comprehensive and additive to each other. Don't ask a physiotherapist or a doctor or a nurse or an occupational therapist on phone. Present yourself first. This is the first lesson for you all. Okay. Yes. So I did do joint replacement for her. But the fracture you fix panni, she's absolutely fine. If you left leg with a right leg straight, she's absolutely fine. Okay. Now, the point now is we'll come back to the main topic, exercise. Exercise is really, really fun. I demonstrated Surya Namaskar also yesterday. Yoga, good or bad? I don't know. Many people have this question to me. Yoga is fantastic. Yoga is a very good way for mental health, balance, coordination, and some flexibility of the joints, but it does not improve bone strength. வளைவு கிடைக்கும், flexibility கிடைக்கும், ஆனா bone strength அவ்வளவா improve ஆகாது. அது மட்டும் ஞாபகம் வச்சுக்கோங்க. Okay. Otherwise, yoga I advocate. At least weekly twice yoga எல்லாரும் பண்ணணும். Okay. Daily பண்ணலனாலும். Is walking alone enough? I get this question. நிறைய பேர் சொல்லுவாங்க, ஒரு 70-year-old gentleman வந்தாரு, he had multiple pains. இங்க அங்கன பார்த்தா bone strength கம்மியா இருக்கு, அதெல்லாம் இருக்கு. When I told him these are the things you have, he was so angry. என்ன டாக்டர், கோயம்புத்தூர் race courseல 4 rounds every day I go. 4 rounds means 4 into 2.3. You make the calculations, close to 10 kilometers he's walking every day. அப்படின்னு சொல்லி ஒரே சண்டை கூட. I was like, no sir, walking மட்டும் பண்ணா பத்தாது. You need something more than walking, irrespective of your age, for your exercise. I'll be talking about it. Okay. Number 3, always wear shoes or go barefoot. Barefoot at your age, above 60 years, வேண்டாம், because the sensation of your nerves, especially if you're a diabetic, the nerves or a sensation குறைஞ்சிருக்கும். கல்லோ முரடோ காடோ ஏதோ குத்தி விட்டுருச்சுன்னா மாட்டிக்குவீங்க நீங்க. So better to wear shoes, not slippers. Slippers போட்டீங்கன்னா you'll go for arthritis of the midfoot. ஓகேங்களா? So use nice flexible shoes for walking. What kind of surface to walk on? உடனே எல்லாரும் இந்த pebble walking அதெல்லாம் பண்ணுவாங்க. Okay, see, அதெல்லாம் the sensory stimulus காரணங்க. If you're a diabetic, be very careful on the surface you walk. Again, pebbles நடுவுல ஏதாவது இதெல்லாம் சிக்கிட்டு இருந்துச்சுன்னா it will cause injury. I've seen patients with the pus pouring out like what you call 30-40 ml அப்படியே flow out ஆகும் ஃபவுண்டன்ல இருந்து வர்ற மாதிரி, because I mean walking on pebbles. Be very careful. It should be a nice surface. Okay, not necessarily smooth, but it should be a nice surface without causing damage to you. Okay, right. Then bicycling and swimming. முட்டி தேஞ்சிருக்கு, knee arthritis இருக்கு, no problem. Bicycling and swimming is totally advocated. But just remember, stationary exercise cycle use பண்றோம் இல்லையா ஜிம்ல, அது நீங்க உங்க seat, the height of the seat should be such that நீங்க இப்படி முட்டி மடக்குனீங்கன்னா இந்த லெவல் மேல போக கூடாது. So your bicycling should be restricted to this. Okay, and not இப்படி அதாவது உங்க hip level knee level இப்படி cross ஆக கூடாது. இத merge பண்ணிட்டே ஸ்டாப் ஆயிரணும். Alright? Okay. So I'll give you 10 tips now. Stretching. Stretch. Stretching is the basis of life. See, take a runner. அவங்க இந்த 100 meters dash இருக்கு இல்லைங்களா, 11 seconds 15 seconds ஓடுவாங்க. To run for 11 seconds they stretch for 10 minutes. We need not really what you call stretch so much. At least 3 to 5 minutes stretching பண்ணிட்டு தான் எல்லா எக்ஸசைஸும் பண்ணணும். I'll give you an example. Take a rubber band. Okay, இந்த rubber band எடுத்து if you drop it after 1 day or 1 week, you look at the rubber band அப்படியே shrink இருக்கும், சுருங்கி இருக்கும் இல்லைங்களா. That's the nature of the muscles and the ligaments. Overnight they all drop down by 5 to 10%, சுருங்கி இருக்கும். அப்படி சுருங்கும் போது when they are contracted, and the muscles and ligaments are contracted, if you exercise a lot they will go for damage. That's why you have to stretch well before exercise. In fact, if you are a patient with arthritis or if you're a patient with stiff body, take a hot water bath. ஒரு hot water குளிச்சீங்கன்னா muscles எல்லாம் relax ஆகும். அப்புறம் stretch பண்ணிட்டு, so after hot water stretch and then do the exercise. Of course you will sweat. So take a second bath. Who said no? You're not losing anything, right? How much to exercise? Okay, this is meant for below 45 years. I say 30 minutes per day, 5 days a week, which is 150 minutes exercise. For senior citizens, I try to improve it as twice a day, 20 to 30 minutes a day. So close to 1 hour. 5 days a week, 300 minutes. Okay, because you need more flexibility and more care at your age. Okay, let's say exercise, you have not been doing exercise and suddenly now you feel, okay, Suman sir sonare, Dr. Suman has told, so let's do it. I cannot be your sir, you're quite senior to me. All right, so now how much to increase the exercise? Increase your exercise by 25% every week. Let us say today you walk for 2 kilometers. After a week, do not cross 2.5 kilometers. Do not is the word. Okay, slow and steady wins the race. Health is also like that. What exercise to do? Cardiorespiratory exercise irukku, resistance exercise irukku. Cardiorespiratory includes simple walks, mild jogs, cycling, treadmill, aerobics, group zumbas, etc. Okay, this alone is not enough. You all have to do resistance exercises. Even if you're 80 years old or 90 years old, you have to do resistance exercises. Yesterday I demonstrated, however old you are, at least take a 500 ml mineral water bottle and start exercising, lifting weights. I showed you 750 grams dumbbell, 1 kg dumbbell, 2 kg dumbbells. Small also, doesn't matter, but just you need that dumbbell. All right. So you have to exercise with all that. So I'll go back in my slide. This is tip 4, right? So let's go to tip 2. So I said 30 minutes means out of the 30 minutes, 15 minutes should be cardiorespiratory and 15 should be resistance, preferably if possible. Otherwise, you change the timing as much as you want, but learn to do both. This is a simple form of resistance exercises using a TheraBand. Yesterday we showed about TheraBand, how to do exercises. There are 6 grades of TheraBand. Okay, and the tensile strength of the TheraBand is 6 grades. For ladies, 1 to 2 is enough. For gents, 3 to 4 is enough. The minute you fall into the senior citizens category, 1 to 2 for ladies and 2 to 3 for gents is more than sufficient. Earlier we had color coding. Nowadays too many companies are coming. Color codes are so confusing. So ask for the right grade and do. Okay. When to stop exercise? You are the best indicator, not your gym trainer or therapist or whoever or your spouse or your friend. Don't listen to anybody. You are not here to hurt yourself. Movies act try panla. You are just trying to keep yourself fit, right? So your body is your best indicator. Know when to stop. Cross training. If you do exercise bore edukunga. Oru naal upper body pannunga, oru naal lower body. Do cardio one day and do yoga one day. Go for a walk. Split, or else do 20 minutes walking and another 20 minutes of let's say lifting weights. Variety is life. Let's say we order a lunch thali. The more the number of cups, the more our mind gets happy first. Whether the taste is good or not, leave it separate. 2 sweets, 1 payasam, 3 puriyals, 1 sambar, 2 variety rices, hot rice, ghee, podi. Now, I paid 200 rupees, 300 rupees. I'm so happy. That's how we feel, right? So variety is life even for exercising. So the more exercises, the more types you do, the better for all your muscles. Okay. For example, I'll tell you in a different way. People who type a lot, right? Computer typing, they get neck pain. Typing, they get like this pain. Bus conductors, they get varicose veins. Bus drivers, they get ankle pain and foot pain. So the reason they are doing the same exercise, other than occupation, they're doing the same exercise again and again. Surgeons, I'm an orthopedic surgeon. I know many orthopedic surgeons with kudikal vali, plantar fasciitis or back pain, spine pain, because they have to bend and operate. Okay, I'm very scared of that. So I do some exercise for that every day. Okay, so the point is, whether it is profession or occupation, if you change the exercise group, exercise group, our whole body, a good tone will set in and you'll be really good. So this benefits of cross training is it is non-monotonous. It avoids overuse of certain muscles. One muscle damage agadu. You get good posture, coordination, a sense of perception. Okay, mental strength will be better because you're doing different things. You're so happy you're doing different things. Recovery is faster and no attrition. You don't get bored. Let's say a person walks for 1 year. Suddenly one day, I'm sick of walking. I don't want to walk. So the attrition irukadhu. Okay. Now, this is a very important slide. It's a silliest slide, but a very important slide. FITT. Frequency, intensity, time, and type. Take a diary. ஏதோ டைரி இப்போ நியூ இயர் டைரி எல்லாருக்குமே வந்திருக்கும். All of you got a new year diary. Please take it and note down the frequency of exercise. What did you do every day? How much you did? How fast you did? What type of exercise? Aerobics and what do you call cardiorespiratory or resistance exercises, whatever you did, please note it down. Okay. In the health diary, you take this health diary at the end of the month. Just spend 20 minutes. Okay. Just analyze the health diary. See what has happened. Okay. How much you have done. First thing you see, oh God, have I done only 15 days this month? Or whether, wow, I've done 27 days this month. First, persistence. Okay, consistency. Okay, consistency is the key to success. All right. Next, number 2, what you did. You may have just done walking, you may have just done skipping or lifting weights. Not good. Change. Variety is life, like I said again. Okay. So next month, you rework it and analyze again. Rework, and do. If you had any illness in between, let's say you got a common cold, 4 days you did exercise, please note that. You cannot be penalized for exercising, not exercising during when you're sick, right? So no problem. Just cancel that area. Okay. Now illness cancel pani, number of days a month, take an average and keep. That is your average value. So let us say 30 days, 5 days you are sick, so 25 days. In 25 days you did 20 days, you take an average and keep a value. Next month, 30 days you had no sickness, 23 days only you did, you take a value. Do something like that. Nothing wrong about it. Okay. A sick body means you shouldn't really exercise a lot, especially age above 60 years. Okay. Okay, I'm sorry. So when to know your exercise is too much? Pain. Pain வந்து ஒரு வரப்பிரசாதம் மாதிரி, வலி வந்து ஒரு வரப்பிரசாதம், கடவுள் கொடுத்த ஒரு gift, God has given it to us. Okay. Discomfort is okay. Pain is not okay, especially when you are above 60 years. I mean, the problem is you overwork your muscle and ligaments. And and once pain starts, they stop working and the load falls on the joint. The joint hits tok like this. For example, I'll show you my model. Okay. So this is the knee model. Okay. All right. So knee kulla there are so many ligaments. Okay. These ligaments keep the bones apart. So you see, I'm pulling it and pushing it, pulling it and pushing it. All right. Now, if I overwork the joint and the muscles will go for waste. And the joint will start hitting. So not only for the knee joint, but for any joint also, this will be a problem. So pain is a marker, something wrong. Know when to stop, take rest and get back into action. Now, there is something called DOMS. DOMS means delayed onset muscle soreness. Okay. ரொம்ப நாள் வாக் பண்ணாம திடீர்னு வாக் பண்ணாலோ இல்லனா ஃப்ரெண்ட்ஸ் எல்லாம் கேட்டாங்கன்னா பழனி மலை ஏறுறது to see Lord Murugaoda blessing வாங்கிருக்கு பழனி மலை ஏறினீங்கன்னா suddenly next day you will feel cramps. Okay, they are cramps, no problem. Take hot water bath, give some ottadam with ice, hot, etc. But please exercise. Don't stop exercise. Okay, that is DOMS. Now injury, there is a difference between DOMS and injury. Injury means you were you were exercising and suddenly you slipped, your leg twisted, you're not able to walk. Now stop the exercise. Don't do. Okay. So gently stretch, massage your muscles very well, rest, ice to reduce the inflammation, okay, and heat to remember ice reduces inflammation and heat will increase the blood flow. DOMS la heat will be better, injury la ice will be better. Okay. Tip 9, do muscles ache if not exercise? Okay, Dr. Suman, ortho doctor solitaare, fantastic, from tomorrow I'm going to exercise. Ithana naal neenga exercise pannadanaala they would have gone for atrophy. This is the word. Atrophy means it's gone for shrinkage. Suddenly when you exercise, it will be painful. Don't worry. Reduce the pace and bounce back slowly over time. No problem. And walking surfaces, right? Soft versus hard. There is something called running surfaces and walking surfaces. For example, grade 1 and 2 is mud and lawn, grass. Okay. Grade 8, 9, 10 is this what you call tar, asbestos, concrete, asphalt. Adala 8, 9, 7, 8, 9, 10 la varum. So choose a surface which is mediocre. Best is mud, school ground, college ground, mud, or a lawn, which is lawn. It shouldn't be uneven surface. It should be an even surface. Walking or jogging on those kind of surfaces is very good for you. Okay, right. People ask me this question: treadmill. Treadmill falls somewhere in grade 5, in between. Treadmill is a smooth surface, but still, if you jog, dog, it gets into a hard surface. Okay, so it's around level 5. It's better than a concrete. Everybody uses computer, including me. Okay, you saw some time back, I was a little lax like this. I suddenly realized I just have to come back to an erect position. Go back to the screens and see, I would have corrected myself. That should be the attitude. Even I correct myself. We are human beings. We're all prone for mistakes. Okay. So sit up straight. Your low back should be, look at this image in the yellow color man. The low back should be snug fit like this. The hip joint should be at 90 degree, knee joint at 90 degree, and the foot 90. Venuma, keep a foot rest here and keep it here. No problem. This 120 degree or 110 degree is accepted. Your level of your eye should be at the level of the top of the computer. Look at me. This is my desktop. So this is the level, my level exactly at the camera, right? So I'm sitting at the perfect height. My seat has been adjusted to me for my comfort. All right. So use a small pillow at the back if you want. Otherwise, it's not an issue. And don't keep the mouse or keyboard far away. Keep them in the 90 degree movement. You can always use an external support here. Nothing wrong. It should be comfortable for you. Don't keep the computer next to a window, etc., where the glare of the screen will come. Okay. Now, I hope you understood about exercises. Last 3 minutes, I just want to talk to you about this keyhole procedure. Everybody is scared of surgeries. Nothing to worry. Nowadays, we just operate with a small 3 millimeter cut. 3 millimeter cut ligaments repair. I just showed you the knee joint, right? So there are 6 ligaments in the knee joint. I just repair them with a 3 millimeter cut irrespective of age. Only if it is mild ligament and mild arthritis. In the camera put repair pannirlam. This is how an arthroscopy looks. This is the ligament. I've gone inside. This is the thigh bone and this is the leg bone, and that is the ligament. Okay, that's enough. But yes, 60 plus, I get a lot of cases of arthritis. Ligaments nothing will be there. Everybody is scared of higher procedures, but you see how the leg was and how the leg is. I'll show you one real life example. This hospital video, see how she is walking. 2.5 months, her speed has doubled. The speed of her walking has doubled. You can see that very well, right? At home, she took this and said, Dr. Paranga Nalla Irukken. I'm very happy. She is the mother of an orthopedic surgeon from United Kingdom. Our team operated, and she's very happy about that. The highlight comes at the end. I'll just forward it. Okay. You see what she will do. People have misnomers. Kilo kara mudiyade, seiya mudiyade, inda prachane, anda prachane, uyir poirum. I mean, our neighbors, they are the spoiled sports of life. First thing we should learn in life to think positive, whether it is for food or for fun or for surgery or for anything. Look at the way she's happily sitting, and this is what we want to give you all. 97% of patients will get away with exercises, medicines, physiotherapy, etc. Some people fall into this. That lady was 77 when I operated. She's 83 now. Look at this guy at 60. All right, but see how he is walking after surgery. I think it's quite self-evident. This is just within 2 months. He's only, I forgot, 62, I think. I'm really sorry. Somewhere below 65. Okay, so he's walking quite well. It is self-evident. Okay, Nera Nadakara doctor, I'll show you the next slide. Look how he's struggling to climb and how he's climbing. This is our hospital. Now, most of you would have come to VGM hospital invariably. It's a prime center, 110 bedded center. So I'll show you again. I'm sorry. See how he is finding difficult to climb, right? And how he is climbing. We just want to give the best for all of you. We really take care of you. It's a real pride that many senior citizens from many old age homes come and visit us for all the medical problems. We will do our best to take care of you. Always remember, don't neglect. If you have developed any problem at age beyond 60, try not to self-treat. See your attending physician immediately, or a MBBS doctor or a MD general medicine doctor. If you have access for a specialist, kindly go and see them, be it an orthopedic surgeon or a pulmonologist or whosoever. Okay. So remember, irrespective of whoever you are, whatever is your age or whatever is the work you do, your body is your temple. It is your responsibility to take care of yourself. I hope this presentation was really useful to you. Take charge of your health. Be happy. Be comfortable. We don't know when our end is. It can be any day from tomorrow to 10 years from now. Every day we live should be a success story for others in terms of fitness and health. That is a Moola mantra I believe in. What is the point in sticking tubes everywhere in the body then if you exercise and at least 30% you can come out of it. And that's the way we should look at life. So thank you so much. I really thank the team of BGM Hospital for allowing me to use the facilities yesterday and today. And I also thank my colleagues of Young Indians and the Kovai Villa organizers who have done a tremendous job in arranging fantastic programs like Musical Fountain. இன்னைக்கு கோவை பத்தி கோவை திருநாள்னு சொல்லிட்டு கோவை பத்தி பேச்சாளர்கள்லாம் பேசினாங்க. Lot of activities like art street, etc., galleries. Yesterday we had a thing with Gandhian philosophies. People of all religions came. Some freedom fighters based families, they spoke on what you call Gandhian principles and things like that. So we are all trying to do something for the society. I'm very glad to be part of this team. Thank you so much. Have a wonderful year 2023. Looking forward to meeting you all in some other